Have you ever wondered if everything you know about acquired anemia is accurate? Today we're going to uncover some common misconceptions. Contrary to popular belief, acquired anemia isn't always due to iron deficiency, nor is it solely an affliction of the elderly. Indeed, this condition can strike at any age, and its causes are as diverse as they come, ranging from autoimmune disorders to drug reactions. Now that we've cleared up some misconceptions, let us delve deeper into the diverse types of acquired anemia. Acquired anemia is a broad term for several types of anemia that are not inherited. These types include autoimmune, mechanical destruction, toxic metabolic, drug-induced infectious, paroxysmal nocturnal hemoglobinuria, PNH, and hypersplenism. Let's dive into these types and their causes. First up is autoimmune anemia. This happens when your immune system, which is supposed to protect you from harmful invaders, mistakenly attacks your red blood cells. It's like your body's defense system going rogue. Diagnosis usually involves a blood test, and treatments can range from steroids to suppress the immune system, to blood transfusions in severe cases. Next, we have mechanical destruction anemia. This is when physical factors like a heart valve replacement can physically destroy red blood cells as they pass through. Diagnosis usually involves a blood test, and treatment can involve surgery or medication to address the underlying cause. Toxic metabolic anemia, on the other hand, is caused by toxins or metabolic issues that damage the bone marrow's ability to produce red blood cells. This can be due to chronic diseases like kidney disease or exposure to toxic substances like lead. Blood tests and bone marrow biopsies are common diagnostic methods, and treatment often involves addressing the underlying issue. On to drug-induced anemia. This can occur as a side effect of certain medications that interfere with red blood cell production or survival. Diagnosis involves blood tests and a careful review of the patient's medication history, while treatment usually involves discontinuing the offending drug. Infectious anemia is caused by various infectious diseases such as HIV or malaria that affect red blood cell production. Diagnosis often involves identifying the underlying infection, and treatment typically involves treating that infection. Paroxysmal nocturnal hemoglobinuria, or PNH, is a rare type of anemia where red blood cells break down too quickly. Diagnosis typically involves specialized blood tests, and treatment can include medications to prevent red blood cell breakdown, or in severe cases, a bone marrow transplant. Finally, there's hypersplenism, where the spleen is overactive and removes too many red blood cells from the body. Diagnosis can involve imaging studies and blood tests, and treatment can range from medication to surgery. Understanding these types of acquired anemia and their causes can help us better manage and treat this condition. We've covered a lot today, so let's recap. Acquired anemia isn't one size fits all. It comes in many forms, each with its own causes. From autoimmune reactions causing the body to destroy its own red blood cells, to external factors like toxic substances, infections, and even certain medications. Conditions like PNH and hypersplenism also play a part. Remember, acquired anemia is a diverse condition with many causes. By debunking misconceptions and understanding its types, we can work towards better diagnosis and treatment. Thanks for joining us today, and we hope you've learned something new about acquired anemia.